NAP4 had a lot of interesting points that were raised, particularly looking at adverse events for airway management. And one was really looking at the issues of aspiration. And the second point I think that's also important is that there was a high rate of complications in patients with obesity. If you're going to use a supraglottic airway, I think it's quite important to make sure that you have a well-fasted patient or a patient that has the possibility of getting sufficient clearance of secretions as well. So I think a supraglottic device, it's probably a second generation, is ideal in those patients. It enables you to do suctioning and removal of gastric secretions, as well as having a higher cuff seal and a better likelihood of getting positive pressure ventilation if you had to use it as a rescue device. So that's one of the sort of take-home messages from NAP4, particularly with supraglottic devices.
I think the take-home point, I suppose, is the fact that we shouldn't forget that there's an easier airway instrument like a supraglottic device such as an LMA or a ProSeal or Supreme that could be easily inserted and perhaps rescue the situation by enabling somebody to continue ventilating the patient and therefore maintaining the oxygenation rather than being focused purely on intubating when the process of intubating is becoming progressively more difficult.
The key messages that are coming out for me are communication, checklists, having algorithms, having people communicate on the same page and understand what it is they're talking about with a difficult airway. What is the difficult airway kit? Do they know what's in it? And do they relate to the other departments within their hospital? Because I think a lot of times we have silos where people are very good at what they do, but when they're interacting with other departments, when things go wrong, there is a bit of a crack in the way that we approach the problems. I think the ability to have good communication, to have our checklist, to have our scenarios, and to have consistency across the equipment that we use and consistency in training across the equipment. They're some of the key things from an emergency medicine and a pre-hospital point of view that we're probably ahead of the game in some ways. I think we've adopted a lot of those things in years past, and whilst there are standards from each of the colleges, the standards between departments and between units can be difficult to attain unless you have a driver such as NAP4 that highlights the errors, highlights the reasons why those errors might be there, and then gives some ideas about solutions to improve for the future.